Hello, wanted to introduce Mrs. Drake. She underwent a Minuteman procedure, which is a treatment for spinal stenosis. It's a very common problem that a lot of us develop as we get older from the effects of gravity and age. And classically, people with spinal stenosis will have difficulty standing or walking any distance because of increasing pain either in their back or their legs or both. And that pain is often relieved with leaning forward on a grocery cart, a walker, a cane, or sitting down. So I wanted to ask you a few questions. Before you had this treatment, what were the symptoms that were bothering you the most?
I had pain in my right hip and my right ankle, and in between was fine. And the ankle caused me a lot of pain, and I couldn't walk very far, and I couldn't stand.
How long could you stand or walk before it really started to bother you?
Maybe 5 minutes.
Okay, all right. So it really had an impact on the things that you enjoy doing during the day. What were some of the things that you found were most difficult, that you really were frustrated because you couldn't do them?
In the evening, it'd get worse, and when I go to cook supper, it was bad. He had to come in and help me.
Okay.
And,
He being your husband?
Yes.
Okay, all right. So he certainly probably appreciates you being able to resume some of these things that you probably enjoy.
Pain too.
Okay. What kind of treatments had you had prior to the Minuteman?
I had 6 shots, 2 here,
Mhm.
and I saw a chiropractor, a surgeon, a lot of different things I did.
You tried physical therapy?
Yes, I did 2 rounds of physical therapy. The second round helped me more than anything.
Okay. And you tried some medications then as well, like anti-inflammatories or
No.
muscle relaxants? Okay. And what did the surgeon tell you?
He wouldn't touch my back, he said, because I had scoliosis, and he said my back was a mess.
Okay, all right. So surgery wasn't a great
Yes,
option.
yes.
Okay. Now, you had the Minuteman about a week or 10 days ago now, and what kind of response have you seen?
Immediate. I didn't have hardly any pain from the incision, and my back hurt a little bit where you went through with the thing.
Okay.
And
So how about the pain that was in your hip and ankle?
none.
So how much better would you say you are since you've had the Minuteman just 10
I'd say
days?
100%.
100%. That's impressive. I wish I could guarantee that for all my patients. So what are the biggest changes you've seen? Are you able to stand and cook dinner now?
Yes.
Okay. Any other things that really stand out? Are you sleeping better, walking further, those kind of things?
Okay before. I'm walking better. I can stand and talk to someone. I pretty much can do everything.
Okay.
I have to be careful.
And not a lot of pain from the procedure itself?
No.
You were out of the surgery center the same day that we did the procedure and feeling better almost immediately then? Okay. And the incision, can you show where the incision is? You don't have to lift up your shirt, but just...
Right here.
So it's kind of on the side. And one of the big advantages of using a minimally invasive technique like this is that we don't have to go through the center of the back to get to the area of the spine we need to work on. We can go through the side, so it preserves some of the muscles that support the spine, and as well as supporting or preserving the ligaments that support the spine. So there's some real advantages to this approach. I'm just tickled that you saw such a good response. I've been pretty impressed overall from all the patients that have had this. Well, thank you very much for talking with us. I really appreciate it.